no doubt, to answer those criticisms as well. Please welcome the Minister for Mental Health and Ageing, Mark Butler.
Well, thank you, Laurie, and thank you for inviting me to address you today. What is a challenging but I think exciting time in the area of mental health. Challenging because mental health, or more particularly mental illness, affects almost every Australian. 1 in 6 of us experience mental illness in any given year, 1 in 3 at some point in our lives. And very few of the rest of us aren't called at some point in time to support either a friend, a family member, or a workmate who is directly affected. Perhaps unsurprisingly, given these numbers, mental illness is the largest single cause of disability in Australia, responsible for fully 1/4 of the total burden of non-fatal disease. But exciting because of the momentum that is built up behind reforming our mental health system. For decades, mental advocates have argued, with some justification in my view, that mental health has been the Cinderella of Australian health policy and health politics. Well, all that changed over the course of the last year or more, and the glass slipper was well and truly produced and fitted very neatly in this year's budget. The past year has seen an unprecedented level of community debate and discussion about the future of mental health services in this country. It's been a passionate, often fiery debate because people care deeply about mental health, whether they are consumers or carers, whether they work in the sector, or simply just live in the broader community. So it's good to have this opportunity to talk about mental health, and more particularly about mental health reform. There are 3 areas I'd like to focus on today. Firstly, the dynamics in mental health over the past year or so and our engagement with the sector in the lead up to budget. Secondly, obviously, the details of the budget package and the breadth of its scope. And thirdly, the ongoing reform challenge in this area and elements of our package that look to lock in a sustained and transparent long-term agenda for change. But let me begin with a frank acknowledgement. Community concern has been building about the adequacy of our mental health system for some years. The implicit compact in the process of deinstitutionalisation, namely that adequate services and supported accommodation would be provided in the community, was frankly not honoured, at least not in full. The evidence of gaps in services and supports in the community have been there for all to see, on our streets, in our emergency departments, and too often in the suicide statistics. And Australians have been awake to it for some time. Late last year, a British university, King's College, published research conducted for it by Ipsos Mori. That research asked more than 1,000 Australians and similar numbers in about 7 other countries a series of questions including this one. What are the 2 or 3 greatest challenges facing your country? Australians, like most, nominated the economy and climate change as the top 2 challenges. Uniquely, though, Australians placed mental health at number 3 on their list. Fully 35% of Australians nominated mental health, compared to an average in other nations of just 10%. Australians were also unusual in nominating ageing as 4th on their list, which started to make me, as the Minister for Mental Health and Ageing, feel a little pressured. But that's a topic perhaps for another day. A great deal of credit for the creation of this level of community pressure lies with a long list of people who have spoken openly and bravely about their own experiences with mental illness. I think it's hard to remember how brave it was of Jeff Kennett at the time to talk about his own battle with depression. People like Jeff Gallop and Andrew Robb more recently have added to that, as have many other public figures. John Brogden's open way of talking about his own attempt at suicide has been incredibly powerful, as has Jessica Rowe's testimony about her experience with postnatal depression. All of those acts of courage, built on a foundation of stubborn and relentless advocacy by countless consumers, carers and service providers, many of whom had struggled for many years to achieve deinstitutionalisation and the mainstreaming of mental health, only to become so disappointed with the lack of proper follow-up in the community. But it seems to me that the role of Patrick McGorry as Australian of the Year last year gave all of that long advocacy and deep community unease, a shape and a profile that the cause had lacked previously. While he had many allies, and not least being the internet connections through GetUp, Professor McGorry was personally relentless in his use of his position last year to create a real sense of urgency for change. And all of that, in my view, is how mental health came to be, for the first time ever, a first-order issue in last year's federal election campaign. Labor heard the community's very clear message that as a nation we have to do better in mental health, and the Prime Minister expressly committed a re-elected Gillard government to doing just that. The Prime Minister's first down payment on that commitment was to create the first ever Commonwealth Ministry of Mental Health. My instructions as that Minister were very clear. Take the time needed to engage properly with mental health stakeholders to understand precisely what their priorities were, and to present then the Prime Minister and the Cabinet with some clear options for reform. The Prime Minister has been equally clear that mental health reform must build on the broader process of health reform that's being led by Nicola Roxon, rejecting the view that Tony Abbott litigated last year that the community had to choose between the two different reform ambitions. The Prime Minister has also stressed that mental health reform depends on much more than just health policy. Good mental health, particularly for the severely ill, depends as much upon things like housing, employment, education, family and personal support as it does on health services. To that end, the Prime Minister established a cross-portfolio working group coordinated by me but reporting to her that marshalled the resources of all relevant ministers and departments. The group included well-known figures like Professor McGorry, Ian Hickey, Monsignor David Capo and Christine Bennett, as well as consumer and carer representatives, paediatric, general practice and psychology experts, and the leaders of Mission Australia and Employment Services Australia. Now, while it might surprise some, this level of cross-portfolio collaboration is not especially common in government. There is a natural tendency for agencies to stick to their own departmental silos. We know, though, that the challenge of dealing with serious disadvantage, commonly described nowadays as social exclusion, is not so much about brand new ideas, because there aren't many ideas that are brand new. Instead, it's about the development of policy, the design of programs, and the delivery of services being seamless. Getting to a position where the public get the range of services they need without having to work out for themselves what the ingredients are and how they get them. This budget delivers the largest mental health package in our history. It should be remembered that the Howard government's package of $1.9 billion over 5 years was delivered in the middle of a 4-year period when the Commonwealth revenue was revised upwards by more than $300 billion over the course of the then forward estimates. The Gillard government's package of $2.2 billion, or 2.5 if you include measures that Tony Abbott includes in his costings, has been delivered in a period when revenue has been cumulatively revised downwards by $130 billion against pre-GFC levels. Other than for its size, though, this package is notable for the breadth of its scope and for its truly reformist bent. Tony Abbott's mental health policy last year was rightly criticised for its singular focus on one age group, teenagers and very young adults. This government's package addresses the whole of the lifespan. There is a strong focus on the earliest years of life. 1/4 of all common mental disorders emerge before the age of 12. Our advisory group presented evidence that as young as 3, infants can present signs of poor social and emotional development. If not caught in time, those challenges can develop